So how can we help our clients who are experiencing chronic lower back pain? So we're seeing now that chronic low back pain is becoming even more common. Either you might have experienced it yourself, maybe your clients have experienced it at some point, or maybe your friends or your family. But I'm sure you know people around you are having issues with their lower back for a period of time. And that's what I mean by chronic. So chronic is something that's probably gone on for more than a couple of months, and potentially they're getting repeated flare-ups. Something we see quite a lot of is people, their pain calms down for maybe a few weeks, a few months, and then it flares up again. So first of all, we've got to get people to understand that just because it's flared up, it doesn't mean it's to do with this tissue that they might have associated it with in the first place. Because the pain and the sensation can still be the same in that kind of chronic stage as it could be in that acute stage. So the psychology towards the pain could be the same. This can be a really big issue. So we can see clients when they get a flare up with their lower back, which could be for loads of reasons that we're not going to go into today, but they get that flare up, straight away they're like, whoa, fear avoidance. They're not going to do that movement or any movement potentially. They might start bracing, they might start becoming quite guarded. These are all really common reactions to experiencing back pain. But then this can lead to issues later down the line. It might lead to maladaptive behaviour. So we've kind of really compensated for the fact that we're not moving in certain parts of the body. This might lead to other parts of the body becoming overloaded. It might mean that actually we've braced so much and protected so much, at some point later down the line when they are having to actually move that body part, it flares up again. Because they've maybe got a poor belief system towards how their back works, because maybe they're a bit deconditioned and the sort of tissue tolerance of that area is quite poor. Loads of reasons, guys. But we can see a cycle happening over and over again with people who are experiencing chronic low back pain. So us as trainers, we want to try and get someone out of this kind of never-ending circle because it's really going to affect their training. You know, every time they get someone they're training, it flares up again and they go round and round again. So we really want to try and maybe avoid flare-ups in the first place, but if they do get a flare-up, also learn how to maybe manage them a little bit more effectively as well. So a good place to start, and a good place I always recommend people who come on our workshops, is to start with a little bit of pain education and to learn a little bit about how pain works within the body. Again, it's not about becoming experts in it, it's just about having a bit of basic understanding and maybe appreciating that if it's in that chronic stage, that it might not be actually related to the tissue itself, it might be amongst of other factors happening that is causing that pain. Then we can start to pass that education along to our clients. And then the next biggest thing we can do, of course, is going to be movement education, getting our clients to move, because that's really what they've come to us for, isn't it? They've come to us to achieve a certain goal, to get fitter, get stronger, get leaner. So we have got to get them to move. So we've got to learn that if we look at chronic lower back pain, we can see a correlation generally between that pain and that dysfunction to sort of a lack of functional movement of the kind of hip region and that sort of lower back region, and probably even up to the sort of upper spine, that thoracic area as well. So as trainers, we probably want to learn how to maybe assess clients' movement around the hips and around the spine, learn how to sort of tweak movement to give people more confidence in how their body moves, give them greater vocabulary of movement, more options in their movement. We can start to present movement to the brain in a different way to prevent flare-ups in the future. And again, it's all part of the educational process. It's all part of offering a better service. So if you'd like to find out any more information about back pain and you want to sort of delve in a little bit deeper and it's a subject you think you've got some interest in, or you think it's something that's going to be really valuable to your clients, then I strongly recommend you have a look at our lower back pain workshop. This workshop is going to go into a lot more detail, guys, about pain and movements we can do with clients who are experiencing back pain. And I'm sure you'll all get a lot out of it.